Thank you so much. And I would, at the outset, thank Dr. Shashi and the whole team of Bhopal for inviting me and my chairpersons. Always from the gut, the microbiome takes a little time to reach the vagina. I think that's why we had a talk in between. From the gut, now we're moving on to the vagina. So we all used to previously talk about vaginal flora. Flora means it used to belong to the plant kingdom because we had only two kingdoms, the animal and the plant. But since microbiota has become so important, it has now formed its own kingdom, which is called the microbiota, and that is why we now have yet another kingdom, and you can understand the significance of it. It has been investigated as long as 1800, that's AD, since then. Initially, it was light microscopy, gram staining, then went into cultures and the PCR, but now it's the NGS. That is the 16S RNA screening. And this is what forms all the basis of our understanding the vaginal microbiota. And it was this man, Jacques Ravel, in 2011, that he used this NGS screening to be able to identify the vaginal microbiota into 5 colony state types. So when we are talking about the vaginal microbiota, now we do not talk about lactobacillus or the others. We talk about what type of CST does it belong to. So the first CST is mainly Lactobacillus crispatilus. The pH is low. It's got a normal epithelium. It has got a very protective role, high stability, and it's mainly present in the perimenopausal, I would say premenopausal women. The CST2 is predominant by the Lactobacillus gasseri. This also has got a good low acidic pH, protective lining, a normal epithelium, low stability, and it is low frequency. The one that we're talking about, the 3, that's the Lactobacillus iners. This is the one that's most commonly present. Now, this has got also a pH of 5. The endometrium, of the lining of the vagina over here, it is protective, but it can move on either side. It's called the neutral one. If it is associated with infections, it can easily move into bacterial vaginosis, or it can keep on the other side. And it has got a very high frequency in peri, and we would say the premenopausal women. The CST5, that has got the Lactobacillus jenseni. This one too has a protective role, high stability, and it has in turn a low frequency. So if you look at all these 5 states, that 1, 2, 3, and 5, they are dominated by the lactobacillus, and these are very protective and do not allow any infections to take place. Now coming to the main one, and that is the CST4. This CST4 has been further classified into A, B, and C, and this is the one which has got very low lactobacillus, as a result of which we have got other organisms which are present, which we know can be Gardnerella, which could be Protovella, it can be Atopium, and when we come to the C, it has got Enterococcus, Streptococcus, and Staphylococcus. So here the pH is higher. The stability of the endometrium has been found to be less. They're far more prone to develop the risks of infection. And this one that we call as the C, that is the one which is predominantly present in the postmenopausal women. So when we tend to put it together, it's the type 4, which is not dominated by lactobacillus, and this is a disruptive condition where the vagina is prone to bacterial vaginosis, aerobic vaginitis, urinary tract infections, and the symptoms of VVA. If you look at the global diversity, there's nothing that it is going to be the same everywhere. It has an ethnicity. So if you look at this, that in India, it is found that crispatus is more common. We do have inners as well as we have gasseri in this. While if you look at the China, that is mainly the one that is found over there is the gasseri. So it tends to vary from place to place, and we should know what is the microbiota of our particular community and about our country so that we can treat accordingly. Another thing we need to understand, that a woman has one particular microbiota, but she can move on into the other CST category. From 3, generally they move on to 4, and this tends to take place when there's use of lubricants, sexual activity, semen, menstruation, antibiotics, and as well as in the menopause. So now let us understand the vaginal microbiota in the menopause. So if you look at this, as the woman moves from the premenopausal to menopause, the estrogen levels tend to come down. As a result of a fall in the estrogen level, the endometrium is thin. The mucus layer over the endometrium is finally reduced. The pH tends to increase. The glycogen levels are less. And as a result, there's less of lactobacillus and there's increased microbial diversity. Taking this in yet another pictorial form, it says that when it is in the transition, it is the CST3 which is there. When it comes to menopause, it's CST4, and when it is nicely post-menopause, it is normally CST4C. And there's a high inflammation, as a result of which the vagina is extremely prone to develop infections like bacterial vaginosis, STIs, aerobic vaginitis. Even the incidence of the VVA tends to increase as the lactobacillus tends to decrease and the other organisms tend to increase. This is where they had studied by taking the swabs, and they realized that as one moves towards a postmenopause, the diversity tends to increase and the homogeneous growth, that is the lactobacillus, is less. And looking at the type of lactobacillus, we see that the lactobacillus tends to keep coming down, and what increases is Gardnerella and the etobiums in a woman who is found to be menopause. Yet this is another beautiful diagram which tends to show us how the change in the microbiota takes place during the menopause. The question now we need to answer is that, could GSM be attributed to a change in the vaginal microbiome? We know that GSM is extremely common, though not many women do come to us for the treatment. In the Indian menopausal women, it's expected to be about 38 to 79% with vaginal dryness, dyspareunia. They have got a lot of burning and itching which is present. We all know that it's the estrogen which is responsible for the GSM, but now the studies are going on whether vaginal microbiota is leading on to increase VVA and GSM. And they have found that the woman who's least symptomatic, the levels of lactobacillus are very high. The ones who have moderate to severe VVA, when they studied the CST, they found that the lactobacillus was less and there was more of the anaerobic bacteria in these particular women. Yet another study done by Brotman et al. In 87 women postmenopausal, they found that nearly 30% had the CST4A. And significantly, the higher the VVA, the greater the chances of having the CST4. And thus it was concluded by all these studies. The more severe the VVA, the higher the chance of having diversity and lesser the lactobacillus and the other the aerobic bacteria. So now let's look at what are the microbiome-directed therapies. We all write lubricants and moisturizers, and I think our patients are very fond and we take it as a first-line therapy. Limited studies are there, but they have shown that when you tend to use these, you tend to disrupt or damage the vaginal epithelium and inhibit the growth of the lactobacillus. So this may not be advantageous. It may tend to lead to more microbial diversity. So what is the role of the MHT? MHT, all studies tend to show it reduces the pH, it tends to increase the lactobacillus, it tends to decrease the colonization of the anaerobic bacteria. There's been a study in 2019 of 45 women receiving oral MHT, and they found that even the oral MHT was significantly increasing the vaginal lactobacillus level and decreasing the vaginal pH, and an improvement in all the symptoms. In 2021, there was a secondary analysis of nearly 120 women. They had used the vaginal estrogens, and they found that the significant improvement in the lactobacillus and a decrease in the symptoms. Taking this into the other way, I would say more pictographically, as we tend to give the HRT, the estrogen level rises, so the thickening of the vaginal epithelium. The level of glycogen increases, the pH tends to decrease, and again we have a higher lactobacillus, all leading to a better symptoms. So we conclude by saying that the MHT effect on the vaginal epithelium, it reduces the diversity, so the atrophy and the bacterial vaginosis. The route of administration, whether oral or vaginal, both have a significant effect, though yes, vaginal tends to increase the lactobacillus much later, much more, and even the tibolone has known to have a much better effect even on the lactobacillus. So there's a symptom relief, there's a decrease in the infections, and the tissue health tends to improve, so the pain during the intercourse tends to decrease when we use the MHT. So what about the probiotics? We know that the probiotics are being used significantly nowadays. They tend to improve the commensal colonization, they tend to block the adherence of the pathogenic bacteria, they tend to reduce the pH, they enhance the epithelial barrier functions. Many studies have been done on this particular one. Using the oral probiotic strains against a placebo, they found that when the oral probiotic was used, there was significant improvement in vaginal symptoms, and they found it to be statistically significant. There was this trial in 2013 when they used a particular compound called Glanofor, which had low-dose estrogen and lactobacillus acidophilus, and they found a marked significant improvement in the symptoms as well as in the UTI. Another study was done using lactin-5, which is crispatus. This was done in premenopausal women who were suffering from BV, and they found it to have a significant benefit in treating the BV. So there are very few limited studies of probiotics being used in the postmenopausal women. But if we look at the effect it has in premenopausal, and we see that it may definitely have a significant effect on the postmenopausal women as an adjuvant therapy. There's been no definite Cochrane review as yet, but there's one large Cochrane review on using probiotics in BV. And they said there's nothing against or for using it. And if we do supplement this for the postmenopausal, we would say definitely we can use this particular probiotics. Other approved therapies of vaginal DH inserts, we're still waiting for them to come to India. They have a significant improvement in GSM and a decrease in the vaginal pH and hence improvement in lactobacillus. Osmifene, again, we're still awaiting this drug to be here. There's going to be a decrease in vaginal pH and reduction in UTIs. So both of them will significantly have an effect by decreasing vaginal pH and improving the lactobacillus. So what are the future strategies that we are looking for? It's a precision probiotics. That is, we tend to tailor the probiotic to be given to a woman depending upon her vaginal microbiome. So it is not going to be a globally one. Depending upon what the microbiome is, we can use that particular probiotic to be able to have a beneficial effect. And we have the vaginal microbiome transplant. This is being used at present for the treatment of bacterial vaginosis with a very high success rate. Many human trials have been done, but we would still say that it is considered to be experimental. Vaginal microbiome transplant is an emerging therapeutic benefit, and we hope it's going to have a significant benefit in the genitourinary syndrome of menopause. Autologous VMT is also being tried in the women who have surgical menopause or who are going in for the anti-estrogen therapies. So the key understandings from here is that a lot of research has been done and will continue being done in the vaginal microbiome and the menopause. Lactobacillus dominance is strongly correlated with vaginal health. In the postmenopausal women who have VVA, we have found a decrease in the lactobacillus and increase in the diversity, and that is attributed to cause the VVA infections in the postmenopausal women. HRT is a very effective treatment, both oral and vaginal, can be used to improve the vaginal health. Probiotic formulas can be used as an adjuvant therapy along with the HRT, or sometimes it can be used alone. Many novel studies have exciting prospects, and we should wait for another decade for a lot of them to come and change the whole scenario. And I would say the vagina lies in the center of the whole circle. We've got the 5 CSTs. We have different methods and ways of improving that. And if we work at each of them holistically, we can definitely improve the vaginal microbiome. And I would end by saying that humans couldn't have evolved to this point. Investigations could not have evolved to this point without the strength of the women in menopause. Thank you so much.